Hello students. Today we are going to discuss the topic myocardial infarction. Do anyone have ideas about myocardial infarction?
Myocardial infarction is otherwise known as heart attack. Heart attack is a medical emergency. A heart attack usually occurs when a blood clot blocks blood flow to the heart. Without blood, tissue loses oxygen and dies.
What are the types of myocardial infarction?
The three types of heart attacks are Saint segment elevation myocardial infarction, STEMI, non-street, segment elevation myocardial infarction, STEMI, coronary spasm, or unstable angina.
What are the causes or etiology of myocardial infarction?
Spasm of the artery. Your blood vessels have a muscle lining that allows them to become wider or narrower as needed. Those muscles can sometimes twitch or spasm, cutting off blood flow to heart muscle. Rare medical conditions. An example of this would be any disease that causes unusual narrowing of blood vessels. Trauma. This includes tears or ruptures in the coronary arteries. Obstruction that came from elsewhere in the body, a blood clot or air bubble embolism that gets trapped in a coronary artery. Electrolyte imbalances. Having too much or too little of key minerals like potassium in your blood can cause a heart attack. Eating disorders. Over time, an eating disorder can cause damage to your heart and ultimately result in a heart attack.
What happens when myocardial infarction takes place?
When a heart attack happens, blood flow to a part of your heart stops or is far below normal, which causes that part of your heart muscle to die. When a part of your heart can't pump because it's dying from lack of blood flow, it can disrupt the pumping sequence for the entire heart. That reduces or even stops blood flow to the rest of your body, which can be deadly if it isn't corrected quickly.
Very good. What are the risk factors for myocardial infarction?
Age and sex. Family history of heart disease. History of preeclampsia, a condition that can develop during pregnancy. Lifestyle. If you have certain health conditions or diseases, the following health conditions can increase your risk of heart attack: diabetes, obesity, high blood pressure, hypertension, high cholesterol, hyperlipidemia, eating disorders, especially in younger individuals.
What are the symptoms of myocardial infarction?
Chest pain, angina. This symptom can be mild and feel like discomfort or heaviness